And our next presenter is Tabby Hurst from Purdue University. She's going to present on early life indicators of future growth in Holstein dairy calves.
Okay, thank you for the introduction. Share my hand. So let's get straight into my objective of my study. So the objective is to determine which factors of early life development affect the growth of dairy heifers up to 400 days of age on a single commercial dairy farm. So we used these variables collected already on this farm, such as serum total protein, to collect passive transfer of immunity. We looked at how total milk consumption from calves and automated calf feeders affected growth, as well as incorporated some things such as genetic information from the farm, body weights collected at incremental time points, and health incidences, as well as we incorporated variables such as season and year to control for some variation. So for the materials and methods of my study, we used 5,186 animals on a commercial dairy farm, and all calves went through an automatic calf feeding system. And there were 8 different feeders, and the average milk consumption on this farm was 508 liters, or approximately 8.5 liters per day. And the farm allowed the calves to have up to 24 liters of milk up to 32 days of age, and they incrementally decreased that amount of milk until they were weaned at 60 days. The farm took serum total protein values for each calf, and the average was 6.7 milligrams per deciliter. And we collected their health incidences from the herd management software. So all employees were the ones that treated these animals, and we found that 4% of calves were treated with antibiotics for scours between 0 and 60 days, and 55% of calves were treated for respiratory disease between 0 to 60 days of age. We also incorporated genetic body size index from the Clarified program through Zoetis, and this looks at the stature, strength, body depth, and rump, and incorporates that into one composite score so that we can compare between animals. And the farm took body weights at incremental times of the calf's life, so at birth, weaning, 4 months, and breeding. But in order to compare animals on an individual a day basis, we predicted daily body weights so that we could compare at a specific day, such as 400 days, which is what we're comparing. So to look at some of these factors that have a significant impact on the growth of animals up to 400 days, we'll first look at milk consumption on the left-hand side, with the y-axis showing our predicted body weight in pounds, and our milk consumption in liters is on the x-axis. And we can see here that there is a quadratic effect of milk consumption, where there is an inflection point where animals who drink an additional liter of milk did not have an increased predicted body weight as compared to animals who had the previous liter of milk. We also found a significant difference in calf birth weight on predicted body weight at 400 days. Here we found a linear effect where the heavier calves were at birth, the higher predicted body weight they had at 400 days. And then when we look at health incidences, we did not see a difference between scours, but we did see a difference between pre-weaning respiratory disease. And to orient everyone, the black bars are animals not treated for respiratory disease. The gray bars are those treated once. The white bars are those treated 2 times for respiratory disease, and the gold bars are those treated 3 or more times for respiratory disease. And if we look at the top graph first, we look at their predicted body weight at 60 days, and we saw a 10-pound reduction in the 60 weight or the weaning weight of those animals that were treated for respiratory disease 3 times versus animals that were not treated for respiratory disease. And then when we look at the effect of their predicted body weight at 400 days, animals who were treated 3 times for respiratory disease versus those not treated for respiratory disease had a 9-pound reduction in predicted body weight. And then when we look at how genetics impacts their future body weight or predicted body weight, to look at this a little bit simpler, we quartiled out genetic body size, and we saw a significant difference between each quartile of genetic body size, showing that the higher the genetic body size index score was, the higher their 400-day predicted body weight also was. And then when we look at the top 25% of heifers versus the bottom 25% heifers, we saw a 48-pound difference in their 400-day predicted body weight. So when we look at overall how the variation of heifer growth is over time, we can look at this graph here. And this shows 5 individual heifers from this farm. And we can note that animals start out at relatively the same or close to the same birth weight, but whenever they reach the 400-pound or the 400 days of age, we saw up to a 579-pound difference between the heaviest and lightest animal. So when we separate that out into 2 of these individual heifers, we're going to compare heifer 1 versus heifer 3. And when we look at the early life predictors that we collected over time that we found that were significant, we saw that heifer 3 had a 177-liter reduction in milk consumption during that pre-weaning phase. Heifer 3 also was 21 pounds lighter at birth, as well as heifer 3 had been treated for 3 treatments of respiratory disease over the 400 days of age, and it had a 0.7 less reduction in genetic body size score. So if we incorporate all of these individual pre-weaning variables and try to select our replacement heifers based on that, we will hopefully select a better, more productive animal in the future. So with that, I will be happy to answer any questions that you might have or send my way. And with that, thank you.